Hey, thanks for checking out some of our mental health resources. We all know and care about someone who's struggling, or maybe we're struggling ourselves. But we do know this, that a lot of people are struggling. And Jesus says that's not how we're meant to live. And so NCC has said that we can't just sit back. We have to do something. And so this series is for those who need hope and for those who want to help. So just like every garden, every lawn, every flower bed has weeds, every one of us has struggles at times as well. We may show roses, but we all have some weeds. Now, I also recognize that we can't address everything in a 30-minute message. And so we've created this resource page to give additional help and hope. So each week, we're going to have an interview with a professional counselor about the topic of the week. We'll have other resources available as well on that resource page. This week, we talked about anxiety and worry. And we're saying it's okay to admit that we're not okay. In other words, it's okay to be honest about our weeds. And I'm super excited to have Michelle Shelton here today. So thank you for doing this, Michelle. And can you tell us a little bit about you and about your practice and about your specialties that you have?
Absolutely, yes. Thank you for having me. And it's something I feel passionately about as well. So as soon as you mentioned this, I jumped on the chance of being here and speaking. So thank you. I have my master's degree in clinical psychology and my doctorate in higher education leadership. And I'm a licensed marriage and family therapist here in Oregon. And so I have practices in Newburgh and in Sherwood. And some of my specialty areas are grief and loss, trauma, and one of the predominant ones, anxiety and worry, depression. And also I feel passionately about speaking and working with clients on suicide prevention and awareness.
Well, thank you for what you're doing. There's a lot of need out there. We know that. What are you seeing now in your practice, or what do you see in our culture right now, especially when it comes to mental health?
Yeah, I'm seeing a great need. Yeah, I'm seeing just a great need, but I'm also seeing an amazing amount of people reaching out. Maybe people who wouldn't reach out otherwise for a variety of reasons. You know, I'm not sure I need it, or I'm not sure where to go, or maybe I can handle this myself, kinds of things, where now people are reaching out and saying, you know what, it is okay to not be okay and to need help and to try and find resources for that. So just seeing a great need, and at times an overwhelming need, especially in our area. And my hope is that there's enough resources and counselors and therapists to kind of fill that need.
Well, specifically, we've been talking about worry and anxiety this week. And so when it comes to worry and anxiety, can you help us know a little bit about what you were seeing or what you were thinking? And I think especially maybe coming out of the pandemic, you mentioned that there might be some expressed needs as well.
Yeah, absolutely. Kind of the first part of the question with anxiety and worry, seeing a lot of people are just uncertain right now. They're uncertain about their job or money or relationships or circumstances. There's just a lot of uncertainty, which then causes a lot of anxiety and worry. Coming out of the pandemic, we're seeing a lot of social anxiety.
What does that mean exactly?
Yeah, what does social anxiety mean? So it's a fear of being around a lot of people. It's a fear of social situations. It's this idea of I'd rather kind of close myself in than to go out in public, or to go in public spaces, or to even go to school. You know, seeing a lot of kiddos and teens, especially going through those pandemic years, that have now they were isolated for a period of time. And so then how do they start fitting in socially when some of those key developmental years were spent in isolation? So quite a bit of social anxiety as well.
So what are some of the solutions, or what's some of the help that we can help people with, or maybe not just clinical or not just counseling, but even as a church or as a family, how can we help?
Yeah, absolutely. First, I would say the biggest factor in kind of all of this, in mental health just in general, but is listening, right? Is listening to our own bodies telling us, you know what, something is not feeling quite right. Whether it's I'm starting to kind of get in my head a little bit, I'm starting to not do the things I would normally do because of anxiety or because of worry, and it's distressing and it's impeding my day in some way. So realizing and listening and being in tune to your own body and your own mind to say, yeah, something's not quite right. I probably should seek out help. as a church body, I think it's amazing to be offering resources, to be offering talks like this, resource page, and again, to be listening to people that we interact with on a daily basis, and to take that time, especially if we hear them starting to use words like, I'm overwhelmed, I'm not sure where else to go, I can't stop thinking about X, Y, Z, and to be able to plug them into resources.
Because in some ways we all have some anxiety, or we
Sure.
have some worries
Yes.
at times. What makes
Yes.
it, what crosses the line? Is it using those key words where I feel overwhelmed, or what are some other
Yeah.
things that you would help us identify?
Absolutely. And honestly, a little amount of anxiety and worry, a little amount of everything, a little amount of ice cream is awesome,
There we
right?
go. All right.
Yeah, a little amount of Burgerville
Right.
is
There we go.
okay, right? So anything kind of to the extreme is usually worrisome. I would say that a little bit of anxiety gets us through that exam we have to take, or that speech we have to give, or something, right? It gives us that impetus to like be able to do something. But when it starts to impact our daily lives in some way, whether it's socially, whether it's professionally, whether it's our physical health starts to act up, we start getting, stress-induced headaches or anxiety stomach aches or things like that, or we're missing work, we're missing school. Those are the times that we know that worry's kind of gone a little bit too
That I need
far.
to reach out and get some help.
Yeah,
Now, as a parent, or for me as a grandparent,
Sure.
we have some concerns sometimes about our kids or our grandkids. We see that. What do you?
Yeah.
How could you counsel us as caregivers, people that we care about a great deal?
Yeah.
If we see something, or we don't know what we're seeing, or we're concerned, where do we go?
yeah, absolutely.
What do we do?
What do we do? Yeah. So what do you do? And then where do you go? Yeah, for sure. Kiddos, it's different. So kiddos and teens can present differently with anxiety.
Okay.
So they can present with anger, or they can present with a tummy ache they just don't understand, or a sudden headache. So sometimes it's somatic, it's in the body, or sometimes they're irritable, or they throw tantrums, where we would look at it as, kiddo's acting up. Why is kiddo not behaving in a certain way? But it could be just not knowing where to place that stress and anxiety and worry. So it gets manifested in anger. So taking a look at those kinds of signs, looking for anger, looking for irritability, looking for crying spells, looking for stomach aches and headaches and all of those kinds of things. So it does manifest differently in kids.
So then we
and
just
teens.
ask more questions and listen, or what?
Yeah.
Is that kind of how we were trying
Yeah.
to assess it?
Yeah, so we ask more questions. We listen. Yeah, listen again is
Right.
is the key word I would hone in on, is taking the time to listen. I also feel like treating the whole person, whether it's kiddo, teen, adult. So asking them when was the last time they sought their primary care doctor or a pediatrician or something like that, because in some of these cases there could be some organic physical reason why either kiddo, teen, or somebody is anxious or worried, or having those kind of physical manifestations of anxiety and worry. So bringing in, a doctor, for instance. And then for resources, okay, so now what do you do with it? Obviously it looks like kiddo is anxious, or you're anxious, or teen is anxious. So there's obviously therapists and counselors, and one place that I refer to folks is Psychology Today. So they have a website. You can plug in, what type of specialty, what area, Yamhill County,
Oh, wow. So it's a database.
Newburgh, and it's a database of counselors of all varieties, and it'll give information such as what insurances they take, what specialties they have, things like that, that might be helpful. If you're looking for just general, like what, I want to just learn more about this anxiety and worry, I would suggest the National Association of Mental Health, the CDC, and also the Cleveland Clinic. So all three have excellent resources, booklets, downloadable PDFs and things like that with additional information. I would say too, to be patient, because the need is great, and the amount of therapists and counselors that are available, at least in this particular region of Oregon, it's not necessarily enough to keep up with the needs. So being patient, and possibly if it's not individual talk therapy, maybe it's group therapy of some kind. There's a lot of excellent group therapy for kiddos, for teens, for adults. So maybe looking into a local group therapy is also a possibility.
Now, sometimes I think I'm being helpful and I'm not.
Okay.
And so what are some things that were not helpful? I mean, buck up and you can do this, or,
Sure.
What are some of those things that I know that I probably made some mistakes on, and I don't want other people to make the same mistake?
No, 100%. And we're not perfect with it. Nobody's perfect with it. I would say not listening.
Okay.
Yeah, not, or listening.
With an answer in mind.
With an answer in mind, yeah, or already figuring out the solution, right? A lot of clients, when they come in, they'll say, yeah, I just, my family or friends or loved ones are trying to be helpful, but they'll just say, oh, I know exactly what you're going through. And that's not necessarily helpful.
Right. It kind of minimizes what I feel.
Right. It doesn't validate, or it minimizes. Yeah, exactly. And so the idea of listening intentionally, not jumping to conclusions, offering resources if you have them, or offering to plug them in to somebody who might have the resources is more helpful than trying to just kind of jump in and problem solve right away.
And it's helpful to say that I'll walk alongside with you, right?
Of course,
because
yeah.
I mean, I'm not just saying I'm going to give you to a counselor, but I'll walk with you. And I'll be
Absolutely, absolutely, yeah. So in collaboration of some kind, and again, it's wrapping around the whole person, and it's physically, it's mentally, it's spiritually, it's emotionally, to get that person to feel whole.
Well, two last questions, and maybe a little bit similar, but any last advice you would have for us as a church on what we can do to kind of step in or be patient, or however we could, kind of come alongside people? And then secondly, is there any other advice you'd give in general for any of us?
Sure, yeah. To the first point, it's interesting. I gave a couple talks here at NCC on suicide prevention and awareness over the years. And I remember the first time I gave one of the talks, I had a lady come up to me afterwards and say, I just think it's amazing that the church is allowing this kind of conversation, where in the past some of these conversations might have been taboo, right. Or we don't do those at church, or those kinds of things. But opening it up like this, opening it up with this series, opening it up with the resources, I think is extremely helpful. And I think always kind of keeping in mind as we're running into people, whether it's in the community, whether it's in the sanctuary, whether it's, the greeters at the door of the church, to just be willing to listen, to just be willing to engage with people, because honestly, you never know if you are that one person that connects and contacts with somebody that needs it at that moment.
Right. Okay. For general, any last advice or words of wisdom?
Last words of wisdom. Oh my goodness. It's okay not to be okay. And I think you maybe mentioned that. Research would bear out that probably half of us have at one point struggled with some type of a mental disorder or mental illness or mental health in some way, or we know somebody that has. So it's kind of breaking down the stigma of it. It's asking for help, being okay asking for help, being okay to not be okay, all of those kinds of things. And be willing to be vulnerable, to talk to somebody. If you're somebody right now listening to this, to be vulnerable, to reach out to somebody, to share, to try and get some help.
Well, thank you for your willingness to help us. And if there's some other opportunities for us, I'm sure we'll connect again.
Yeah, thank you for having me.
Thank you.